Anne Milton is not a household name. But if we're reading the runes right, then she will be tomorrow. The obscure education minister is hotly tipped to replace hapless Jeremy Hunt in the cabinet reshuffle. And she has all the right qualifications for the job. Where Mr. Hunt was a former marmalade salesman, Anne Milton was a nurse for 25 years. While Mr. Hunt's only connection with hospitals before becoming health secretary was to be born in one, Anne Milton worked her socks off in them. She has experience in medical research and palliative care, and knows the Royal College of Nursing and National Childbirth Trust inside out, having worked with those two. As medical staff struggle against the odds to cope with the latest winter crisis, we can think of no one better than Anne Milton to understand what they're going through. Under the Tories, the NHS has been brought to its knees, starved of cash as a victim of their misplaced austerity agenda. That it is able to function at all is testament to the devotion and tenacity of its staff. But the NHS needs more than just another injection of taxpayer money. It needs another way of working. An NHS based on a system that worked in 1948 when it was founded is no longer fit for purpose in 2017. Medical science has come a long way since then, and so has the price of it. Patients who would certainly have died 70 years ago are now given years more life by our wonderful doctors and nurses. Those who can afford it may have to contribute more towards that in future. As the population ages, the more health care it needs. These are the challenges Anne Milton will face. Cabinet reshuffles are tricky, especially for a PM as weak as Theresa May. But she should hold her nerve and appoint Anne Milton tomorrow as she intends. Anne Milton's Commons nickname is Scary Spice. That's just what the NHS needs if it is to survive and thrive, spicing up after years of neglect. And someone to scare the government into ensuring it has the resources it needs.